Doctors' offices usually ask the patient to sign something that they take responsibility for paying the bills if patient's insurance company doesn't cover it and patient is responsible for paying that amount or whatever the charges are for a certain service. Unfortunately, some doctors' offices don't submit the claim properly, and based on that signature that they have from the patient, they charge the patient, and pretty much patient end up paying for doctors' offices billing department's negligence. You can't prevent this fully, but there is a way that you can reduce the amount of mistakes that is done from doctor's office's billing department. First of all, before you leave a doctor's office, make sure everything that they have ordered for you, they have ordered it under the right diagnosis code. For example, after certain age, mammogram should be done annually, and that should be covered fully by most insurances because it is considered preventive care. So, before you leave your doctor's office, make sure they have submitted that request to the imaging center under the correct code, which is preventive care. If they submit that under the wrong code, you will end up paying for something that your insurance would have fully covered it. And that is correct about some other services as well, such as bone density colonoscopy. After certain age, patient can get a free bone density test done every 5 years, and that's part of the preventive care. Just make sure your doctor submitted correctly and double check it with the imaging center or whichever institute or center that you go for your test. Make sure they have the correct diagnosis code. I hope you get the right and direct response from both offices because sometimes it's really hard to get the information from them. They don't respond or whatever, but you have to give your shot.